But I will try in 10 or 15 minutes to explain what is andropause according to him and according to me in 90% of his talk. You know that andropause is a great problem because we treat the menopause, but nobody treats the andropause. A few number of practitioners have this opportunity. Dr. Shosha is present in many countries, in Paris, Hong Kong, a lot in Asia, Tokyo, Seoul, and a little bit in China. He developed a concept and spread his concept all in the earth. We age because our hormones decline. Our hormones don't decline because we age. It's the inverse. I think a great number of you knows this. Testosterone replacement therapy is safe and can provide dramatic benefits, you will say. Many other hormones need to be replaced, but how? You know perhaps that testosterone is connected to many other hormones in the body. When you treat by testosterone, you treat the whole body. What's andropause? Andropause is a problem, a very silent problem. Menopause is very brutal, very starting at 50, in 6 months or 1 year, you have no more estradiol. But for andropause, it's very slow, very silent. So this means that when you see the men, often you see them 10 years after the andropause, or 15 years. So some damage already happened in the brain, in libido, in many organs, because testosterone is a whole body organ, like estradiol for women. The symptoms of andropause. Some symptoms are very easy. Cold limbs, sweatings in the night, for example, is a good symptom, but also many psychological symptoms. Social isolation, for example, is a good one. When your husband stays at home instead of going to see his friends, he is andropause, probably. Also insomnia, some depression, irritability. He is never happy, never more happy. Sometimes suicidal tendencies, it can happen. Also weakness, fatigue, muscular pains, muscular fatigue, particularly after an effort, even a small one. The loss of appetite, constipation, weight loss, but weight loss not from the fat, weight loss from muscles. Sarcopenia, the beginning of sarcopenia is a good sign of andropause. And many urinary symptoms during the day, during the night, and you have a thin stream of urine, frequent desire to urinate, particularly in the night, and difficulty to urinating, particularly during the night, due to hypertrophy of the prostate, and many sexual problems. And when you see men, they come first for sexual problems only. They don't think to the belly, they don't think to muscles, they don't think to irritability, no, only erection. When erection decreases, the men come to your office. When you look at the testosterone level, comparing a young man and an old man, you see this, but also you have a disorganization of a secretion of testosterone. Because testosterone is driven by LH hormone. When you are young, you have very good pulse and regular pulse of LH. When you are aged, you have dysregulated LH secretion. It means dysregulated secretion of testosterone, a lower level of testosterone. And this explains many troubles in mind, in fatigue, in muscles, in libido, in erection, and so on. But testosterone targets organs a lot. Brain, libido. When you have not enough, when you have too much, it can be aggressive. It can give you an aggressivity. Increase in strength and volume of muscles, all the muscles. And when you have a man with a big belly, it means not enough testosterone, very often. Kidney stimulation. Kidney is very important, and also for the filtration, the glomerular filtrations, testosterone is important. The bone marrow, the stimulation of stem cells, of red cells, hemoglobin is a good sign. When you have a decrease in hemoglobin for a man, it means not enough testosterone. For example, when you have a face pale for a man, it's low testosterone. The bone, we know that testosterone is very important for bone growth, for the calcium content in the bone, male sexuality organs, the penis size also, the spermatogenesis, and the prostate growth. But the problem when you age, you will see is that testosterone decrease, but dihydrotestosterone increase. And this is not good for the prostate. The liver, you know that testosterone is a protective hormone against steatosis, for example, from liver steatosis. But not by oral route, only if you take by skin route. And the skin is also very important because hair growth, balding sometimes, sebum production is linked to testosterone and to DHEA. The male hormone health profile, this is in Chinese or Japanese, I don't know, but you will see that at 30 or 40 years old, most of men experience a drop in testosterone, but they don't know in them blood enough to get the sign of low testosterone symptoms and enough to justify to start testosterone replacement. And it's true, particularly in our societies, because one of the big enemy of testosterone is stress, is cortisol. When stress rises, cortisol increase, and testosterone decrease, particularly rapidly in the saliva. Immediately after stress, 2 minutes after, your testosterone decrease. So in our societies, men have a lot of stress from the job, from family, from women now also. So we will have more and more new anthropos. And so it's true now. I think it's very true. For the effect of testosterone, it's on muscle, skin, brain, bird, body, prostate, but the thymus, the decision make also. When you have a lot of testosterone, you are very able to decide rapidly when you have a problem. When you have low testosterone, you hesitate during a long time. This is also a good sign. And also your look, your face, your skin, the quality of your skin, your posture, all these things are linked to testosterone. The erotic brain, the urinary tract, all these things, and the memory. When you lose testosterone, you lose memory also. And you see already that you have some hormones, testosterone, DHT, and estradiol. We will see this. And testosterone is bound in the blood by SHBG, the sex hormone binding globulin. You have 3 hormones in questions in anthropos. Testosterone first, estradiol, DHT, and these hormones are linked to some enzymes. Aromatase is the enzymes able to transform testosterone in estradiol. And we know now that in men, you have a very small level of estradiol. But the problem is not the level of estradiol, it's the power of estradiol. Estradiol is 100 or 1,000 more powerful than testosterone on the receptors. So even if man has a small level of estradiol, it can be very harmful rapidly for man, particularly on the prostate. Because we think now that the starter of a prostate cancer is probably estradiol. And for the growth of prostate, it's DHT. When you have these 2 hormones rising when you age, your risk of prostate cancer increase, like breast cancer for women. So 5-by-5 reductase, you have 2 types. And these types are able to build DHT. And you have no reverse. When you have built DHT, you cannot reverse to testosterone. And when you have built estradiol, you cannot reverse to testosterone. So aromatase is a very strong hormone, and it's an hormone, a one-way hormone. So it is very important to think. Because when you have built estradiol in a human body, in a man body, you cannot reverse. And this can give you gynecomastia. And one of the things able to stimulate aromatase, you have stress, you have cortisol, but you have also alcohol. When you age, try to not so much drink alcohol, because alcohol is a great stimulator of aromatase and can provide rapidly gynecomastia, even if you take testosterone. And also, the inhibitors of phosphodiesterase, every man knows this, Cialis, Viagra, and so on. So I think now the LH stimulating the testosterone and the pulse of LH, and the SHBG, which can rise when you age and decrease the content of testosterone, of free testosterone. The steroidogenesis, you know that it happens first in the mitochondria. So if you have a lot of oxidation in the mitochondria, you will have less production of pregnenolone and less production of testosterone. So you need good mitochondria. And to have new mitochondria, to have good mitochondria, you need to exercise. When you exercise, you create new mitochondria. So to preserve your testosterone when you age, even if you don't want to take a treatment, please exercise every day. You will be a winner. I think you know this sham, and you know the transformation of testosterone in aromatase and testosterone in DHT. DHT is 10 times more powerful than testosterone. The treatment now. We have a lot of treatment. The easier is probably transdermal testosterone. From 3% to 10%, it depends the people, it depends the skin, it depends the absorption. You can give it begin at low dose, probably 3 or 5%, and you check after your guy 3 months after or 6 months after. Normally, you should see the hemoglobin rising. You should see an improvement in sleep, in muscle quality, in libido, in memory. It should be slimmer. It should lose fat and take more muscles. You have also testosterone, mesterolone, endocannabinoid injection. You can have injection every 3 weeks or 2 weeks with, for example, endocannabinoid of testosterone. This can be easy for some people. And you can also have nebido injection, which is a very long-term injection of 3 months. But I think the best is always the testosterone in gel because it respects the natural circadian rhythm for men. You know that the secretion of testosterone happens every day in the morning. So if you have injection, you have a long term of testosterone. It's not physiologic. It can be very good for aged people, for example, nebido. And if you need to have more sperm, or if you have very small testicles, some people inject HCG to rise the size of testicles. This happens for bodybuilders, for example, because they take a lot of testosterone. So after 1 year, they have testes like a squirrel. So they need HCG to rise the size of the testes. But it's not natural. It's not a therapy, yeah? In conclusion, if you have too much estradiol, you will have gynecomastia, or too much alcohol. It's the same. Too much DHT, you will lose your hair. You will have alopecia, but androgenic alopecia. You can fight with finasteride. But finasteride can rapidly decrease your libido for men. So if you want to give it to men to fight DHT, please give very, very low dose. 1 milligram a day is sometimes too high for many men. And too much testosterone is aggressivity. So now our world scientist is through endorsed testosterone replacement therapy. It's for everybody, for every man now. It's possible. And this is how much the male hormone replacement can keep your patient younger. You can stay young with testosterone. More long time. Thank you for your attention. Tu te mets dessus, voilà.
Ouais.
C'est bon, ça va s'ouvrir. T'avais souri là.
Ok.
Ah, c'est bon. Tu te mets dessus là. Tu te mets ici.
Okay, super. So, hi everyone, and thank you to be here for this topic, a little bit different. So maybe it will cancel your carbon tax now. So we are going to talk a little bit about climate change, effect, and beauty and longevity resilience. So no conflict of interest. So first of all, we are going to talk a little bit about senescence and the effect of environment on this topic. Also, climate and aesthetic adaptation. And we will talk about inclusive climate impact, and finally, the strategy for future. So, first of all, a brief story of senescence. So, I don't know if you're so familiar with this concept, but if we are looking for the cell cycle, we show that a senescent cell, what is that? It's just an irreversible stop in the G1 and or G0 phase of the cell cycle. So it's not functional active, but it's still metabolically active. And we have two kinds of senescent cell. The classical with telomeric signal, so short telomere means senescent cell, or non-telomeric signal with oxidative, genotoxic, oncogenetic stress. So it leads to what we call SIPS, so the stress-induced premature senescence. So it's the same finality, but it's not the same concept because it's induced by environment factor. So what is a senescent cell? What is the characteristic in histology? There is a lot of marker, but some are more important. Noticeably, the Ki67 marker, you know that for tumor, but it's really important in senescent cell because this ratio just is slowed down. So what is mark? It marks the lower rate of proliferation. We have also a phenotype called SASP. We're going to talk later about it. And the lipofuscin is a mark of proteostasis deficiency and the accumulation of AGE. It's the end product of glycation, so we talked about that before, so you know about it. And also the carbonylation of protein, which mark the chronic stress. So what is the SASP phenotype? I'm just emphasize on that because in a lot of study you are going to see that. So what is SASP? It's a senescence-associated secretory phenotype. So what does it mean? It means an inflammatory cytokine, chemokine, matrix remodeling, and growth factor secretion. So it does impact the tissue local environment. And the other effect of the SASP phenotype is the risk of atherosclerosis, the risk of neurodegenerative disease, and insulin resistance and fat abnormality. And the SASP phenotype has this particularity to get a paracrine and autocrine communication. So if you get a cell with this kind of phenotype, it can provide to the other cell the same senescent effect. So what is the effect of environment at the cellular level? We have ozone. So just to make it clear, we have ozone from stratosphere, so it protects us from UVC and UVB, but we have ozone in troposphere, and that ozone is the most harmful for the skin, noticeably on epidermidis, with the release of a lot of inflammatory factor and lipidic peroxidation, so skin barrier alteration. And on the dermis, it alters the quality of synthesis of collagen. So we get early wrinkling, early photoaging, and delayed healing and cicatrization. We also have UV effect, but I think you know about it. And EV metals. We have a lot of EV metals in our daily life, in water, in our skin products. And we point out recently that cadmium containing in smoking can lead to psoriasis. Also, smoking can lead to an increasing of thickness of the skin, stiffness, and also a telomeric shortening in white globule. The nanoparticles are everywhere around us, and the most important are the PM25. It's just about the diameters, and it causes the decreasing of tight junction. You know a little bit about leaky gut in the intestine, so it's quite the same on the skin. So it causes DNA demethylation and also the breakdown of collagen 1 and elastin. And for sure, air pollution does have an impact by inhalation, producing the SASP phenotype in lungs, by ingestion and exposition on the skin directly. So I really like this figure because it summarizes all we have said and the parallel between the cellular senescence and the skin aging. Finally, it's quite the same. We have the ROS, the SASP, the protein quality control, and the inflammation. Inflammation is really the cause of senescence process. So yeah, and it's quite easy to study the skin function because of this high rate of renewal. This other figure is a really good summary of the cellular level and skin level and all the environmental factors, which lead to the inflammation, the SASP phenotype, and the accumulation of protein. This accumulation of protein is really a huge issue because when you have an accumulation, an aggregation of bad protein, it can lead to autoimmune reactivity. So that's really important. So it's a data from the WHO. Climate change in all areas with disease factor, with natural disaster, and psychological effect and conflict cause 13 million deaths each year. It's 1/4 of all deaths. So it's a huge challenge of nowadays to involve the health problem with climate change and this rapid urbanization. So I'm going to talk with you about a funnier story. Climate sometimes can lead to aesthetic adaptation. Yes. And yes, we have the story of a climate nose. So now you can shine during Saturday night with the maestro of nose surgery, just telling this story. Yeah, get your cover. Because finally, there is study proving that the shape of the nose can finally be adaptive. And this difference in shape may be due to evolutionary benefits unique to each of those climates. It's so rational because in tropical warm area, we need to take a large amount of air just to breathe. So it can live with flat nose and open nostril and wide. It's a favorable genetic marker. Greater rates, greater intake of air. And if you go to the coldest country, the intake of cold air is not a favorable marker because it may irritate membranous lining. So that's why we have a small nose with closed nostril that prevents this cold air intake. So we can say finally that this phenotypic evolution is beyond over the genetic factor. That's the result of the study that show, because they study if genetic drift alone is sufficient to explain this trait among population. And if the results show an accuracy far away from FST, it shows us that phenotypic differentiation exceeds the expectation under neutrality. So now we can talk about heat, cold, dryness, and humidity and the impact on skin condition. What about humidity and skin moisture? We have a study which shows that skin conductance, elasticity, and fine wrinkle were due to low humidity factor. And just after 30 minutes of acclimatization. So yeah, 30 minutes with a rate of 30% lower in humidity can affect skin properties. Another study, it's more an experimentation. Just put some people under 10% or 80% of rate of humidity and tracking how the expression causes the skin to fold. And what we have seen is in the low humidity condition, finally the skin fold were more intense, and even after all relaxing the facial expression. And also running air conditioner. Okay, it's cool to cool down, but it's a really dry hair. So it's also harmful due to the drying effect and the loss of moisture that weaken elasticity of the skin properties. Another aspect is the multi-ethnicity of the world now, with travel, change of demographic, the change of the gut, and earlier skin aging timeline. And what we have seen is that the early stage of skin aging depend of ethnicities. And with Asian and West African people, the early sign of skin aging is more photoaging with pigmentation. And for Caucasian people, it's more about wrinkle. We also see that the microbiome of the skin in young people is rich in phylum and firmicutes. But with age, we get an increasing of bacteroid and protobacteria. Also in dysbiosis, So when you have some issue with your digestive system, with your microbiome in digestion, it can lead to an early stage of skin aging. And here is an example of harmful of skincare exposure. Because as we have seen, photoaging and damage with lentigen are most represented in the world now, and the use of skin lightening is overused now. So what is the problem? The problem is that skin lightening may contain a little bit of mercury. And as you know or don't know, mercury can cause on the skin rashes, discoloration, scarring, and also on health, nervous, digestive, and immune system damage, and also anxiety and depression. So the Minamata Convention fixed a threshold of 1 milligram per kilogram, but what we have seen is that 10% of this all skin lightening product exceeds this limit by a multiple of 100. And it represents a market of $11 billion for skin lightening product projected by 2026. So we need to be alert by this condition with the sign of mercury poisoning with our patient, even in aesthetic consultation. Just ask what are their products using, because finally it can lead to other issues and continuous skin disorder like rash and anxiety and other things like that. So it's really important. So now, what are the global health impacts of climate change? Is health the human face of climate change? Maybe yes. Because we have a lot of impact beyond just the environment change. We have socio-cultural impact. Why? Because of climate change and all natural disaster, we have a lot of migration and new world map, new mix of different culture. And as you see in the world and in the society, sometimes it collapses. So it gets a huge impact after that on stress and psychological aspect. Do you know that we need 3 generations for people to be good in a new country? It's a study after the Second War. You need 3 generations, because the first, it's all about survival. The second, it's just about adapting and create something new. And the third is finally adapting to its new environment. We also have the disease vectors, so airborne and waterborne vector disease flares. And we need to be aware that finally, with this move of population, maybe we will have new disease that don't have anymore in our country. And also people with the same disease but with usual therapy resistance. And we need to be aware of that, because the map of disease is going to change. And also about denutrition and malnutrition. Why? Because of the change of the oceans. Because the oceans is becoming more acid with a lot of salts. So what does happen? The fish and seafood just run away from the equator to the pole. And what we have in this area, we have the poorest countries in the world. We have 2 kinds of countries. We have the big urbanization country, like Brazil, etc. But we also have the really poor country like Madagascar. So it can lead to denutrition in this kind of country, and on the super urbanized country, maybe more metabolic syndrome, because finally the high carbohydrate refined products are always for the poorest. So what about air pollution and skin condition? Air pollutants can enter the skin via nanoparticles, so via air follicles and sebums. We see the oxidation of sebum when you're exposed under pollution. So it produces kinins, which after that produce the oxygen-reactive species. So the innate skin antioxidant defense is overcome, it's saturated. We have a depletion of enzymatic system, glutathione, peroxidase, reductase, and catalase, and non-enzymatic such as vitamin E, C, glutathione, selenium, zinc, vitamin A. We have seen that with people just living at 100 meters from big road, we have the depletion of this kind of vitamin. So we need also to be aware with our patient, even in aesthetic consultation, because in a big, huge urbanized city, we need to supplement in this kind of vitamin just to amplify our results also, and to take care of the inside, for sure. So we get premature aging, photodamage, solar lentigion, melasma, and increase of rate of psoriasis, atopic dermatitis, acne, and also an increasing of severity of the symptoms. So what are the climate effects on aesthetic industry? We need to focus on skin vulnerability because of this high rate of dermatitis, and also the skin barrier which compromised now. So the innovative product may focus on that. And also the hypersensitivity of people because of stress factor, because of impulsive choice, insatisfaction, doubt, and all of that can lead to wrong choice, and after that, big insatisfaction during consultation. As I said, we need to be aware of this multi-ethnic population. So we need to adapt education to fit with cultural beauty result expectation. Because finally, if the population change, the demographic change, we will have some people from all over the world with other base of beauty standards. So we need to adapt and to communicate better. So it's really important. And maybe the question of supply shortage, because there is this question in a lot of fields now, so why not in aesthetic industry with this rising inquiries and maybe the future defect of production and feedstock, we need to be aware of that. So what about strategy? Strategy, yeah, we are all in late, but we are all in together. So we need to get collective learning, collective data, innovative process, and also ubiquitous education. An inclusive mindset as an aesthetic future with collective in and out optimization and standardization, industry innovation, like we said before with Exosome, it's really, yeah, I think a good approach. And also a home optimization with air filter, water filter, just to avoid these heavy metals and nanoparticle exposition. We need more data and prediction, and just to be aware and share the disease resurgence, just to communicate quicker. We need to be aware of this psychological effect and also rely on aesthetic industry to become carbon-free. So yeah, global awareness, as I said, let's connect together, let's share our case, our side effect, our population current expectation, and so on. And what about air pollution daily regimens? So a lot of study shows us that it's really protective to adopt a Mediterranean diet, which in omega-3, which is rich on anti-inflammatory molecule and natural provider of antioxidants such as vitamin A, vitamin E, selenium, zinc, etc. We need a strong morning routine in skincare, including sunscreen and vitamin C and air pollutant barrier and close pore toner to avoid this exposition and absorption of nanoparticles. We need a regenerate dinner repair evening routine. So huge importance of cleansing retinol, resveratrol, hyaluronic, and chondroitin sulfate. And for sure, we need to avoid the tsunami effect, so the cumulative effect with chemical, pesticide and UV, smoking and UV, ozone and UV, because it amplifies the risk. So what is a wish list of protective ingredients? So we need to base our cosmetic on probiotic and prebiotic just to restore the skin barrier. On an innovative product, the BDDI, it's a transient HAR antagonist, and it decreases the SASP phenotype production. So it has a really good action anti-wrinkle, and also it provides the health of skin barrier. For sure, vitamin E is essential, and also vitamin C, which neutralizes the free radical and limits the collagen breakdown. But it's better when he is with his friend, vitamin E, ferulic acid, and fluorectin. Oral supplements based on catechin and green tea plus vitamin C will have a specific action on fibrillin 5, which is the structural constituent of elastin, which provide a protection against UV damage. And for sure, the diet rich in phenolic compound, all purple stuff will work, phytosterol and saponin, which help fight particle-induced cellular oxidative stress. And also a lot of study shows that the supplement by NAC, so N-acetylcysteine, protect skin damage from smoking. So yeah, thank you. Do you have any questions? Yeah, that's me. Thank you. Yeah, if you want to join the collective conscious doctor awareness, just to share a new idea on what you're seeing.
So, thank you to be here and to stay here because it's probably late, you are tired and eventually angry. So, I would like to, how to switch. could change.
Tu fermes là.
Yeah. And
Après, tu reviens là.
okay, so what I would like to present you is some new concept in biology with a lot of outcome in anti-aging medicine. Because what you have to know is that everything starts in laboratory of research. What you see in innovation in medicine starts in the lab and in my lab, for sure. So everybody probably in the room is looking for the philosopher's stone, and because probably the fountain of youth is able to cure all the disease, because it's not only on the field of aesthetic medicine, but also in the field of disease. But also because we age at different speed, and we have to understand why we age at different speed. But anyway, it's also aging is also associated to age-related disease, and this is a big issue to stay healthy late in the life. And even more, because we age at different speed, we cannot speak really on chronological aging, but first more in biological aging, because eventually you are 10 years older or 10 years younger. We have to evaluate this before to do something on aging. And maybe because aging is reversible. And this is my focus, to see whether we can prevent aging or reverse aging. So a simple view is why we age. And a simple view is because our cell age. But we have to know how they age. Our cell experience during their life many different stress, endogenous stress, exogenous stress, and it leads to damage. The cell has to repair the damage. If she can repair the damage, she keeps some hallmarks of this damage, and this is what we call epigenetic drift. So it means that the epigenetic, organizing the gene expression, drift with the age, and the cell express differently the genes, and it leads to an impaired cell plasticity. What we call that cell deprogramming, epigenetic deprogramming. If the cell is not able to repair, either she go into apoptosis, so you have with the age a decrease in the number of cells, a decrease in the tissue, or she stay in a specific stage already presented by Dr. Hu before, and the senescence. And the senescence is a very specific cell stage with a big impact on aging. We know that now. But there is not only these two feature of the cell aging. There is many different features, and there is a sort of consensus now with different hallmark of aging. Initially, there was 9 hallmark of aging, as you can see on the slide. But now there is probably 12 or more. But what is interesting is that if you follow cell aging with this hallmark, you can eventually target also this hallmark and prevent this cell aging. Again, cellular, there is many different stress able to trigger senescence. There is telomere, you know, this extremity of chromosome decreasing inside each division of the cell or easily damaged. So telomere attrition can lead to senescence or oxidative stress, DNA damaging agent, even oncogene activation can lead to senescence, and proliferation, DNA replication stress, and also epigenetic alteration. So what you have to know is that it's a robust cell cycle rest, and the cell is not dying, is like a zombie cell, is in between life and death, and she activates some pathway leading to senescence, P53, P21, P16RB. But the most important probably is that the cell become resistant to apoptosis. We know that now that these cells secrete many different factors, and initially it's a tumor suppressor because it stops the cell cycle, prevent evasion of the cell in a non-expected proliferation. But what is secreted is different factor with different property. Metalloproteases that can disorganize the tissue, the matrix, growth factor that can push the proliferation of cells, and also pro-inflammatory cytokines. So it leads to a sort of new concept in the field of senescence with new function of these cells, not only preventing tumor, but also additional function. But to have a SASP, a fully mature SASP, takes time. It takes approximately 10 or 15 days. And there is different steps forming this type. There is, at the end of the formation of the SASP, this NF-kappa B inducing a lot of pro-inflammatory cytokine. And the idea of this is that, in fact, initially it was discovered that this senescence was able to participate to wound healing. Because if you follow all these factors, when you have a damage, you have senescent cell, you have to make some place, so you need metalloproteases, you need to make cell proliferating, so again, and pro-inflammatory cytokine, this is the signal for the immune system, the innate immune system, to clear senescent cells. So during a lot of time during your life, when you are young, you don't have senescent cell remaining. But with the age, your immune system is less efficient, and they accumulate in the tissue. Initially, we identify 80 factors of them. Now, the senescent cell, we know that they secrete 300 and more factors, and depending on the type of the cell entering the senescence or the type of the stimulus of the damage leading to senescence, there is different SASP. So there is really a need of reinvestigation of what is really senescent cell. Sometimes they are good for the tissue. We know that these cells are also involved in regeneration, even in embryogenesis, in forming some organ. But at the end, when they accumulate, and this is the problem with the age, they can even promote tumorigenesis, inflammation, and aging. So it's a big issue to mitigate or to control senescence. When your tissue age, the secreted factor do not stay only in the tissue. You can find them in the blood. And if you follow the level of this factor in the blood, the factor of the SASP, you can even monitor your biological age. And also, it's a good factor in clinic to prevent or to make diagnostic on disease and disability, and even on surgical risk. The other part I spoke about is epigenetic drift. What is epigenetic drift? What is deprogramming? Your cell is programmed, and the expression of your gene is programmed during embryonic development. But with the age, you have this chronic stress and this chronic repair of damage that make this epigenetics deriving, and you change the gene expression. At the end, there is different level of this modification. It could be DNA methylation, some marks on the DNA. It could be histone modification, the organization of the genome, or the factor remodeling everything. At the end, you have an impaired cell plasticity and your cell age. with this methylation on the genome, we can you can derive some epigenetic clock with a very efficient activity in trying to identify precisely your age. So some are able to identify your chronological age, and other your biological age. It's a really important issue in medicine field, because we have to know where you are in aging. And even more, this clock can predict the age of your death. So basically, if you look at your aging tissue, what kind of cell you have? You have two types of cells: deprogrammed cells and senescent cell, not more. It could be differentiated cell or stem cell, but each time they are either deprogrammed, epigenetic drift associated, or they are senescent. And what is really important in the field of medicine is that we found these two cell type associated to all the age-related disease, not one, diabetes or so on, everything, even degenerative disease. So it leads to a paradigm shift, in fact, a new concept, indicating that eventually what we have to treat is the aging of your cell, because the aging is the sort of the mother disease, and what we know as age-related disease are probably only the consequence of this cell aging. So now, does it exist some strategy to delay or reverse aging? And for sure the answer is yes. The first, probably a good start will be physical activity and diet. But still, for sure, there is this senescence. We have to try to delay senescence, to clear eventually senescent cells, because the immune system is not able anymore to do that in the age, or to try to mitigate the effect of the SASP secreting, because the SASP is able also to trigger senescence in neighboring cells. So it's it's contagious. But also reprogram age cell. So if you deal with these two aspects, normally you will save a lot of healthy lifespan. This was the first proof of concept. When you kill senescent cell, you can see the difference in animal model, and this animal save 30% of healthy life when they are treated with molecule clearing senescent cell. So it led to a new field in medicine, what we call xenotherapy. So it means that first it was to try to find some molecule able to trigger senescent cells specifically and kill them, because they are not they are resistant to apoptosis. So there is the objective to wake up this mechanism, this innate mechanism of the cell. So the first molecule were chemical molecules that atinib, it's even anti-cancer drug, but it works to kill senescent cell. So in fact, there is two different opportunities. There is senolytics that can kill senescent cell. There is also xenomorphic molecule. So it means that you can, with this, mitigate the effect of the SASP, decrease the synthesis of these factors, or stimulate your immune system to be sure that it keeps efficient to clear senescent cells. So there is some synthetic molecules, but also natural compound with this kind of efficiency. And even more, there is a clinical trial, actually, in US, essentially, to try to fight age-related disease with this kind of molecule. So there is a lot of clinical trial, actually, to do that. But this field target age-related disease, but as I presented before, probably we have to do something before and to treat the patient before the disease, because the problem is already done when you are ill. So the other part is to target deprogrammed cells. So initially when we start this, we asked the question whether or not cellular aging was reversible, because to do something initially, and we benefited of this famous discovery of Professor Yamanaka, who showed that if you start from an adult cell, so it was skin cell, with 4 factors, OCT4, SOX2, KLF4-CMI, you can convert these cells into pluripotent stem cell equivalent to an embryonic stem cell with self-renewal capacity, but also the ability to redifferentiate in any kind of cell of the body. But he showed at this time, a little bit later, with 6 other groups, that senescence and aging was a barrier to reprogramming. But he was wrong, because we modified this cocktail of genes. We had 2 genes, and we start from cells, senescent cells, and cells from even centenarian people. And we were able, with this sort of reprogramming cocktail, to derive induced pluripotent stem cell and then redifferentiate them into fibroblasts. We started from fibroblasts from dermis, and we redifferentiated into fibroblasts, and we compare them. And at the end, we observed that the cell was fully rejuvenated with a physiology of like a baby cell, really. So it was the demonstration, and we were the first to demonstrate that cellular aging was reversible. So with this technology, we can do a lot of things. We can reprogram a cell from a patient with age-related disease or with a premature aging syndrome, and then redifferentiate them to recapitulate the aging and try to find some molecule to prevent the aging tissue. This is what we did with the premature aging syndrome, with age-related disease. But we can also now produce and derive organoid, even human organoids, such organ in the dish, to do the same that if we differentiate in one cell, we can do in organ, and even reproduce all the skin. We can also go into cell therapy, because you can, with the cell redifferentiated in a juvenile cell, try to inject the cell and correct. We did that also on an European project for the intervertebral disc degeneration. And as I just said, we can do also a skin model, organoid skin model with this reprogramming strategy. But for sure, this is in the dish, and we can go to pluripotent stem cell. Okay, but what in the body? Is it possible to derive this strategy? The answer is yes, and we develop a 2.0 reprogramming strategy, inducing reprogramming and stopping them before that they go into pluripotent stem cell. So we bypass this kind of pluripotent stage, and we did that on mouse model. When we collect the cell, the fibroblast of this mouse model, we observe that after induction of this short transient reprogramming, we decrease DNA damages, we also decrease senescence, and we improve autophagy. Autophagy is a mechanism of the cell able to clear damaged component of the cell, so it's a sort of rejuvenation. But even more, if we do that early on in the life of the animal, a very short reprogramming, 2 weeks and a half, we can save 50% of healthy life. What it means, healthy life? It means that we prevent tissue deterioration. We also prevent tissue fibrosis, age-related pathologies like osteoarthritis, osteoporosis also, through, for sure, an epigenetic reprogramming. But also, what is absolutely amazing is that just after the reprogramming, we have this improved body composition. So it means that during all the rest of the life, the mouse maintain the muscle mass and decrease the fat increase. And you can see that even the skin, this is the same magnification, treated, reprogrammed or not. So there is no necessity to comment. This is just to acknowledge all the people working in my lab and for this project. And if you want to have further explanation, I did a TEDx. I also published a book and also a documentary in Arte. So what next? You have understand that my objective is the Graal. And so for this we develop a biotech, a startup for cell reprogramming and skin rejuvenation with all these people, and even the chairman, Claude Chauchard, not present today. But with this biotech, we have now to develop cell reprogramming and skin rejuvenation, a partnership with Helena Rubinstein for the next 5 years. And probably in the future, everything will be aggregated in the project I have in Montpellier to create an international institute for healthy longevity, not targeting age-related disease, but preventing aging of your cell. Thank you for your attention.